Hello, my name's David James. I'm a paediatric emergency medicine consultant in Southampton and the emergency care lead for Healthier Together. In this short video, we're going to describe the remote assessment of children with diarrhea and/or vomiting. We're going to use the Healthier Together pathway for this, which can be found on the website under the Professionals tab, GP Primary Care Staff, Clinical Pathways Remote Assessment. This is what you'll open. This pathway is suitable for primary care colleagues, so GPs, advanced clinical practitioners, nurse practitioners, also for clinicians working through the 111 service. You'll see at the top a note that this is often thought of as being a likely diagnosis of infectious gastroenteritis. However, it's really important to remember that not everything presenting with diarrhea and/or vomiting is true gastroenteritis. Be on your watch for other things. And you'll see a list of things there, including high fever, shortness of breath, altered state of consciousness, and many others there that would have to make you think about a different diagnosis. Let's move on to the pathway. You'll see that, as per all other Healthier Together pathways, it's red, amber, green, where the red action is a referral to hospital, amber action is a further review in primary care, either face-to-face or by video, and a green action is the provision of a safety netting advice sheet. Starting, all under 3 months who present with either diarrhea or vomiting, we would suggest should be seen clinically face-to-face or by video. There are some behavioural cues that might alert you to the child being very unwell. A lack of any response, or if they are roused perhaps from being asleep, they don't stay awake, or concerns about the nature of their cry should result in them being seen in hospital. If the child is not as sick as that, but is certainly not their normal self, not smiling, a bit miserable, decreased activity, tired or irritable, please make sure they are reviewed in primary care. Moving on, skin. You'll see there some features of shock, so being mottled or perhaps being blue or having cold extremities. Those children should be seen in hospital. In the absence of those, perhaps there's some features of dehydration. Do they have a dry tongue? Are their eyes dry? Or in the case of a baby, is their fontanelle sunken? They should be reviewed in primary care by video or face-to-face. You'll also see in the bottom right-hand corner some other factors that perhaps might increase your risk of being dehydrated. A useful marker of hydration can be to ask about urine output. Children who have not passed urine for 24 hours should be seen in hospital. For those in whom it's only 12 hours, a primary care review would be appropriate. Any child with DMV who has abnormal or fast breathing should be seen in hospital. Finally, there are some other factors we want to see. Is there blood in their stool or vomit, or is the vomit dark green? Or as for all of these pathways, are they under 3 months with a temperature greater than 38? They should come to hospital. In the context of a fever of more than 39 in a 3 to 6 month old, these should be seen in primary care, as should any other children in whom there are additional parent or carer concerns that cannot be met over the phone. Finally, in the absence of any red or amber features, the family should be reassured and should be provided with a safety netting advice sheet. This hyperlink takes you to that. And again, you'll see it's red, amber, green for the family, just like it is for the professionals, with some additional information at the bottom. To send this to the family, please click the green button in the top left-hand corner, indicate that you're not a robot, pop the number in and send it. Thank you for joining us today. I hope to see you on more videos soon.